High blood pressure, the silent killer. You might feel perfectly fine, but inside your body, it could be quietly damaging your heart, brain, and kidneys. In today's video on Medical Study 19, we are going to break down everything you need to know about hypertension, from what it is, why it happens, how it affects your body, and most importantly, how you can control it. Stay tuned because this is the information that could save your life. Hypertension or high blood pressure is one of the most common health problems worldwide. According to the WHO, about more than 1.2 billion people live with hypertension and many don't even know they have it. Why is it dangerous? Because uncontrolled blood pressure increases the risk of heart attacks, stroke, kidney failure, and even vision loss, often without showing any symptoms. That's why it is called silent killer. Now we will go into the definition section. So, what exactly hypertension? Hypertension is also known as high blood pressure is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. The systolic blood pressure will be more than or equal to 140 mm of Hg and diastolic blood pressure will be more than or equal to 90 mm of Hg. Now, on the classification of hypertension or types of hypertension, it is classified into three categories. Prehypertension, when systolic blood pressure ranges from 120 to 139 mm of Hg and diastolic blood pressure ranges from 80 to 89 mm of Hg. Hypertension stage first, when systolic blood pressure ranges from 140 to 159 mm of Hg and diastolic blood pressure ranges from 90 to 99 mm of Hg. And stage 2 hypertension, where systolic blood pressure becomes more or equal to 160 mm of Hg and diastolic blood pressure becomes more or equal to 100 mm of Hg. And another type is pregnancy induced hypertension. It is due to the increased production of hormones and enzymes during pregnancy. Now, causes. Hypertension can be primary hypertension and secondary hypertension. Primary hypertension develops gradually over years, often due to genetics and lifestyle, and without an identified cause. And secondary is caused by another medical condition such as kidney disease, normal hormone problems, certain medications, or sleep apnea. And the causes and risk factors for hypertension are unhealthy diet, especially high salt intake, being overweight or obese, lack of physical exercise, smoking, and excessive alcohol, stress, age. Risk increases as you get older. Alcohol, smoking, diabetes mellitus, and family history also affects. Now, pathophysiology. In hypertension, the normal blood pressure is maintained by four mechanisms: sympathetic nervous system activities, activities of vascular endothelium, activities of renal system, and activities of endocrine system. Sympathetic nervous system activities. When the blood pressure is decreasing, the of activation of sympathetic nervous system will occur. The increased sympathetic nervous system activity increases the heart rate and cardiac contraction. The increased heart rate and cardiac contraction produces vasoconstriction in the peripheral arterioles and promotes the release of renin from kidney. The net effect of sympathetic nervous system activation is to increase the arterial blood pressure by increasing cardiac output and systemic vascular resistance. Here, blood pressure is equal to cardiac output into systemic vascular resistance. Now, activities of vascular endothelium. Vascular endothelium is a single cell layer of that lines the blood vessel. It will produces vasoactive substance and growth factor like nitric acid, endothelin, etc. These substances are potent vasoconstrictors and cause increased blood pressure level. Now, activities by renal system, or it is also known as renal aldosterone angiotensin system (RAAS system). In liver, angiotensin is secreted. Now, angiotensinogen is converted into angiotensin first by renin released from kidney. This angiotensin first is converted into angiotensin second by enzyme ACE, also known as angiotensin converting enzyme, which is released from the lungs. Angiotensin second acts on the adrenal gland to stimulate the release of aldosterone. Now, this aldosterone acts on the kidney to stimulate the reabsorption of salt, NaCl, and water (H2O). In this way, the volume of blood is increased. Now, that increased volume will cause the pressure increases. In the same way, angiotensin second also acts directly on blood vessels, stimulating vasoconstriction and narrowing of blood vessel, leading to increase in pressure. In this way, RAS system works. Now, activities of endocrine system. When the angiotensin second is stimulated in the adrenal cortex, it will secrete aldosterone. I have already told. The aldosterone will stimulate the kidney to retain sodium and water. Thus, blood pressure and cardiac output will increase. Now, in pathophysiology, in hypertension, blood pressure becomes stiffer and narrower over time. This makes the heart pump harder to push blood through the constant high pressure damages the inner lining of arteries, promoting plaque buildup, a process called atherosclerosis. This can eventually block blood flow or cause vessel to rupture, leading to the heart attack or stroke. Now, what are the clinical features or symptoms? Most people with hypertension have no symptom at all, so it is known as silent killer. In some patient might experience such as severe headache, dizziness, blood vision, nosebleed, but these usually occur only when blood pressure is extremely high. That's why regular blood pressure checks are essential. Now, diagnosis. Diagnosis is simple. Measure your blood pressure with a reliable monitor. Doctors usually confirm hypertension by taking readings on different days because stress, caffeine, or even white coat syndrome can temporarily raise it. Complication of hypertension includes heart disease, heart attack, heart failure, enlarged heart, stroke, kidney damage, eye damage, cognitive decline, etc., and so on. Now, treatment and management. Mainly, the management of hypertension is possible by two ways, which includes lifestyle modification and pharmacological management. In lifestyle management, you can mainly includes weight reduction, DASH diet means dietary approach to stop hypertension. Eat balanced diet rich in fruits, vegetables, whole grains, and low fat dairy. Dietary sodium reduction, uh, reduce salt intake. Aim for less than 5 gram a day. Exercise at least 30 minutes most of the days. Maintain a healthy weight. Limit alcohol. Quit smoking and managing stress. And in pharmacological management, various group of drugs are used for the treatment of hypertension. Collectively, these drugs are called antihypertensive drugs, which includes diuretics. It helps the kidney to inhibit the sodium reabsorption in the distal convoluted tubules, ascending limb, and loop of Henle. These drugs include chlorothiazide, furosemide, beta blockers. These medication reduces the workload of heart and blood vessels and causing the heart to beat slowly and with less force. Drugs includes atenolol, propranolol, alpha blockers. This medication causes the peripheral vasodilation of the blood vessels. Example, parazosin and vasodilators. These medication acting directly on the muscle in the wall of arteries and preventing the muscle from tightening and arteries from narrowing. These drugs include nitroglycerin, sodium nitroprusside, ACE inhibitors. This group of medication will reduce the conversion of angiotensin first to angiotensin second and prevents vasoconstriction. The drugs of ACE inhibitors include captopril, ramipril, and calcium channel blockers. This medication will block the movement of extracellular calcium into the cells and causing vasodilation and decreased heart rate. The drugs includes amlodipine, verapamine. Even if you don't have hypertension, prevention is a key. Maintain a healthy lifestyle and get your blood pressure checked regularly and take action early if it starts creeping up. Here it is the nursing management. Now, hypertension might be a silent, but with awareness, healthy habits, and timely treatment, you can control it and live long, healthy life. This is medical study 19. I hope today's videos helped you understand hypertension better. If it did, hit the like button, subscribe, and share this video so more people can protect themselves from the silent killer. Thanks for watching and see you in the next video.